Multiple sclerosis in women. What to know? Multiple sclerosis is an autoimmune condition that interferes with the flow of information in the central nervous system. It causes a variety of symptoms and can affect women differently than men. Researchers do not know that what triggers multiple sclerosis. Once it develops, the disease causes the immune system to destroy a type of tissue called myelin that insulates nerve fibers. Without enough myelin, it is difficult for the nerves to transmit and receive signals properly. Multiple sclerosis randomly affects nerves in the brain, spinal cord, and eyes, meaning that it can cause a wide range of unpredictable physical, mental, and emotional symptoms that vary from person to person. Multiple sclerosis in women. According to the National Multiple Sclerosis Society, at least 2 or 3 times more women than men receive a diagnosis of multiple sclerosis. Overall, multiple sclerosis seems to affect men and women similarly. However, a doctor cannot predict which symptoms someone with multiple sclerosis will get, the severity of the symptoms, or the progression of the disease. The reason for this is that the disease attacks the myelin randomly, and the nerves that it affects can differ from person to person. Although men and women with multiple sclerosis often experience similar symptoms, certain factors such as menstruation, pregnancy, and menopause may influence multiple sclerosis symptoms in women. Symptoms of multiple sclerosis in women. The symptoms of multiple sclerosis in women are similar to those in men, but they can include additional issues due to hormonal changes. Multiple sclerosis can also affect female sexual health and bladder function differently. Multiple sclerosis symptoms in women include vision problems. For many people, a vision problem is the first noticeable symptom of multiple sclerosis. Multiple sclerosis can cause various vision problems which include blurred vision, poor color vision and contrast vision, painful eye movement, blindness in one eye, a dark spot in the field of vision. People with multiple sclerosis develop vision problems either because their optic nerves become inflamed or because they have nerve damage in the pathways that control vision, visual coordination, and eye movement. Numbness. Numbness in the face, body, arms, or legs is another common symptom of multiple sclerosis, and it is often one of the earliest symptoms of the condition. The numbness can range from mild and barely noticeable to severe enough that it interferes with everyday activities such as holding objects and walking. Most periods of numbness from multiple sclerosis resolve without medication and do not become permanently disabling. Fatigue. About 80% of people with multiple sclerosis experience fatigue or unexplained exhaustion. Sometimes the cause of fatigue relates to another symptom of multiple sclerosis. For example, people with bladder dysfunction may sleep poorly because they have to wake throughout the night to go to the bathroom. People with multiple sclerosis who have nocturnal muscle spasms may not sleep well, leaving them feeling tired during the day. Multiple sclerosis can also increase the risk of depression, which can cause fatigue. Another type of fatigue that seems to be unique to multiple sclerosis is called lassitude. A person's fatigue may be lassitude if it occurs daily, worsens as the day goes on, happens in the morning even after a good sleep, worsens with heat or humidity, interferes with daily activity, is unrelated to physical impairments or depression. Bladder problems. Bladder problems affect at least 80% of people with multiple sclerosis. This issue occurs when scars on the nerves impair nerve signaling that is necessary for the function of the urinary sphincters and bladder. Multiple sclerosis can make it difficult for the bladder to hold urine and may reduce the amount that it can store, causing symptoms such as more frequent or urgent urination, hesitancy starting urination, frequent overnight urination, being unable to empty the bladder, being unable to hold urine or having urine leaks. Bowel problems. Many people with multiple sclerosis experience bowel problems such as constipation, diarrhea, loss of bowel control. Bowel problems can make other multiple sclerosis symptoms worse, especially bladder problems, muscle stiffness, and involuntary muscle spasms. Researchers think that people with multiple sclerosis have problems controlling their bowels because of the neurological damage that the condition causes. Some people with multiple sclerosis may also have trouble controlling their bowels when they are constipated. Pain. Some research suggests that 55% of people with multiple sclerosis experience clinically significant pain, while 48% live with chronic pain. Women with multiple sclerosis may be more likely than men to experience pain as a symptom of this condition. Acute multiple sclerosis pain seems to be due to problems with the nerves that helps transmit sensation in the central nervous system. Some of the symptoms that people with chronic multiple sclerosis pain may report include burning, aching, pins and needles, prickling. Many people with multiple sclerosis also experience chronic pain as a secondary effect of the condition. For example, it could be due to compensating for gait changes, muscle stiffness, cramps and spasms, incorrect use of mobility aids, muscle changes from mobility loss. Cognitive changes. More than 50% of people with multiple sclerosis experience changes in cognition, which means that they may sometimes have trouble processing new information, learning and remembering new information, organizing information and problem solving, focusing and maintaining attention, properly perceiving the environment around them, understanding and using language, doing calculations. The cognitive symptoms of multiple sclerosis are typically mild to moderate and only affect a few aspects of cognition. In rare cases, people with multiple sclerosis may experience disabling cognitive problems. Depression. Clinical depression is one of the most common symptoms of multiple sclerosis. Depression is more common in people with multiple sclerosis than in people with other chronic health conditions. While almost everyone experiences periods of sadness or grief, clinical depression refers to depressive symptoms that last for a minimum of 2 weeks. Some of the symptoms of clinical depression include loss of interest in everyday activities, increase in appetite or appetite loss, sadness, irritability, insomnia or excessive sleep, fatigue, feelings of guilt and worthlessness, difficulty thinking or concentrating, behavioral changes, thoughts of death or suicide. Clinical depression can also worsen other multiple sclerosis symptoms including fatigue, pain, cognitive changes. Muscle weakness. Many people with multiple sclerosis experience muscle weakness. This symptom is due to damage to the nerve fibers that help control muscles. People with multiple sclerosis may also experience muscle weakness because a lack of use has led their muscles to become deconditioned over time. Multiple sclerosis related muscle weakness can affect any part of the body. It can be especially challenging for people with multiple sclerosis to walk and stay mobile when muscle weakness affects their legs, ankles, and feet. Muscle stiffness and spasms. Multiple sclerosis can cause spasticity, which is muscle stiffness and involuntary muscle spasms in the extremities, especially the legs. Some of the signs and symptoms of spasticity include tightness in or around the joints, painful, uncontrollable spasms in the arms and legs, lower back pain, hips and knees that bend and become difficult to straighten, hips and knees that stiffen while close together or crossed, dizziness and vertigo. Some people with multiple sclerosis experience dizziness and the sensation of being lightheaded, woozy, weak, or faint. Less commonly, they experience vertigo, which makes it feel as though a person or their surroundings are spinning. Multiple sclerosis may cause vertigo by damaging the pathways that coordinate the spatial, visual, and sensory input that the brain needs to maintain balance in the body. The symptoms of vertigo include balance problems, motion sickness, nausea and vomiting, being lightheaded, a spinning sensation. Sexual problems. People with multiple sclerosis often experience sexual problems and may find it difficult to get aroused or have an orgasm. Multiple sclerosis may reduce natural vaginal lubrication, potentially making sexual intercourse painful for women. The disease can also cause sexual problems by damaging nerves in the sexual response pathways that connect the brain and the sexual organs. People with multiple sclerosis can also experience issues with sex as a result of other multiple sclerosis symptoms such as muscle spasms and stiffness, mood or self-esteem changes, fatigue. Emotional changes. Multiple sclerosis can cause a wide range of emotional symptoms and changes, including mood swings, periods of uncontrollable laughter or crying, irritability, grief, worry, fear and anxiety, distress, anger or frustration. The condition is unpredictable, often has fluctuating symptoms and can become disabling, all of which can be scary for someone. Multiple sclerosis can also cause emotional changes by damaging the nerve fibers in the brain. Some of the medications that people take to manage multiple sclerosis can cause mood changes too. For example, corticosteroids can have many emotional side effects including anxiety, irritability, agitation, tearfulness, restlessness, fear. Difficulty walking. People with multiple sclerosis can develop problems with gait or how they walk because of several factors. Multiple sclerosis symptoms that affect how a person walks include muscle stiffness and spasms, numbness or other sensory problems in the hips, legs, ankles or feet, fatigue, muscle weakness, loss of balance. Hormonal effects. There is some evidence to suggest that multiple sclerosis can affect women differently than men due to hormonal changes, including those that occur during menstruation, pregnancy, and menopause. Pregnancy can reduce the risk of multiple sclerosis symptom flare-ups, especially during the second and third trimester. Researchers think that pregnancy has a protective effect against multiple sclerosis by raising the levels of compounds that help reduce inflammation and the effects of the disease. Anyone with multiple sclerosis who is pregnant or planning to become pregnant should discuss their medications with their doctor. Some multiple sclerosis symptoms that pregnancy often exacerbates include fatigue, gait problems, bladder and bowel problems. Multiple sclerosis symptoms may worsen after menopause, possibly because declining estrogen levels adversely affect disease progression. However, it is difficult to tell whether multiple sclerosis symptoms worsen because of menopause or just as a natural result of aging or the progression of the condition. Much more research is necessary to understand the relationship between menopause and multiple sclerosis symptoms. Rarest symptoms. While the symptoms are the most common, multiple sclerosis affects everyone differently. Less common symptoms of multiple sclerosis include speech problems, seizures, hearing loss, swallowing problems, tremor, breathing problems, itching, headaches.